we'll talk about the steroids. We'll talk about the definition of steroids, a simple layman definition. We'll talk about the occurrence of the steroids, where these steroids occur actually. Then we'll talk about the actions of the steroids. After that, we'll discuss with you guys the use and the misuse of the steroids. Like we'll talk about, especially, we'll talk about the bodybuilders when they're using these steroids. So what is it going to do to them, and what they are actually concerning, what they are actually thinking about it, and what is actually happening with them. In short, we'll talk about a lot of things here. So let's get started from the very first point. That is actually the definition of the steroids. How will we define steroids? Simple. We'll say that these are actually substances or molecules that are having a specific structure. Now, what that specific structure is simple. We have six corner rings. How many rings? Three rings. Okay, they're having six corners, and one will be a five corner ring. So these two means four ring structure is there. If this structure you find anywhere in the hormones, in the vitamins, and etc., then those are actually called as steroids. Okay, simple definition. Now, how that structure looks like? Simple. This is the way you will actually observe the structure of the steroids. And a 5-1. That's it. So here we got 1, 2, 3, 4 ring structure. So if you see such kind of ring structure in any of the vitamins, hormones, and etc., substances, those are actually called as steroids. Okay, in short, simple understanding to you guys, for you guys. So well, a steroid can be a hormone, it can be a vitamin, it can be anything. And the very important thing is that must be having this particular nucleus. That's it. Now, where these steroids occur? Simple. We have naturally available, like in our body, we have a gland. Here is a sort of a structure of the kidney. On the top of this, we have a gland known as adrenal gland. So in that, we have this cortisol being synthesized, and we have testes. In that, there is testosterone available. Remember, these testosterones are also available in the female, where the ovaries named as cells named as thecal cells are actually responsible to synthesize these testosterone in a very minute quantity. In male, it is in excess. In female, it is less. Well, so in short, these occur naturally as well synthetically. If we take these and synthesize it in the laboratory, that is actually then called as synthetic steroid. Well, now let's come towards the next point, that is about the actions. They have multiple actions. Here I will just discuss with you guys some of those actions. Number one, it is actually responsible to maintain the integrity of cell membrane. We know about the cell membrane. It's actually a phospholipid. Lipid bilayer is there, and the proteins are there. Along with that, you will find some kind of structures like this, not like this, but there are some other structures named as cholesterol, which is actually a steroid, and that is actually responsible to maintain the integrity of the cell membrane. Means the cell membrane structure will be maintained. You will not observe a kind of disturbance in the structure of the cell membrane. If any other external or internal agent is causing a change in the cell membrane, there is this cholesterol, this steroid, which is responsible to maintain the structure. In short, it is responsible to play important function in the cell membrane. That is actually to maintain the integrity, to maintain the structure of the cell membrane. In the vitamins like vitamin D, it is actually having anti-inflammatory action within the body whenever there is a kind of any inflammation. So in that inflammation, there will be a kind of important role being observed by these steroids. And again, if there is inflammation in the body again, so for that inflammation, we are using steroids concerning our physicians and the pharmacist. According to their suggestion, then we are using these steroids to treat those inflammations. And then we have like diseases, certain diseases are there, autoimmune disease and etc. For that, again, what we do, we use steroids. And athletes, for the performance, to increase their performance, athletic ability, they are using the steroids, which is actually a misuse. Well, anybody can do the misuse, but what we are supposed to do is to guide you guys, not to do the misuse. What if you take a normal dose after when you're diagnosed by the physicians and you are suggested by the pharmacist? So when these are actually suggesting you the normal dose, Dose is actually told to you by the pharmacist, the accurate dose, and the physician will actually diagnose you for a particular problem. So then these two, by their mutual understanding, mutual discussion, they will suggest you guys with the perfect steroid. Then that will be responsible to treat you or either cure you also. So it is actually a kind of life-saving, steroid is actually a life-saving substance. What substance? Because it can be a hormone, it can be a vitamin, means it is actually a kind of substance which can save your life. But if you misuse this can damage your liver, your kidney, your heart, and etc. 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 And it can cause you some other diseases like the hypertension, the sugar, the diabetes, and etc. Other diseases can be caused by the misuse of the steroids. Well, what people are doing, a misuse, a very simple and important type of misuse that is actually observed in our area, that is regarding those they are actually those people, they want to increase their athletic abilities, they are using the steroids. Like in the gym, they want to build their body, they want to share their lipid fat, they want to do the fat loss in a very fast way, they want to build proteins, muscles. In short, they're using what steroid they're using to have a perfect, a strange type of the body. So for that, what they're doing, they're using the steroids in excess. Example is the one used, that is anabolic steroid named as testosterone. So that testosterone is actually available in the steroids. They are some gym trainers suggest these kind of testosterones to their students, those who are actually undergoing the transformation. If you want to transform your body and if you are taking these testosterones, remember guys, most of the trainers, they don't know the exact and accurate amount that you guys must take, but you must go for a special type of trainer, the one who will actually train all these things. And in short, if someone is suggesting you the proteins, remember, the protein that is available at the gym, that is not pure protein. In that, there is a dent of the testosterone available already. That testosterone is again responsible to cause damage to you. For all, I want to tell you people about this important thing, that is, do not misuse these steroids. If you are using the steroids in an inappropriate manner, it will cause damage to you. So I told you people about the damage, the major damage that is can be cause liver damage to you, kidney and heart. Another important damage, a transformation that is supposed to be caused is conversion of the male into female and female into male. What? Simple. If you are a guy, male, you are using testosterones, these anabolic steroids, this will start converting you from the male to the female. Why and how? Simple. Simple, very simple. In the male, we have testosterones already available. Our body is actually synthesizing it naturally. What you are doing, you are taking the excess. This external and excess testosterone is responsible to suppress the already available testosterone. What will happen? Your testes in the very beginning will shrink, means the size will reduce. And next, if you are using this for a longer period, you may have male boobs. In short, you will start converting to female, means your body will be like that. And what is it doing to the female? The same testosterone is available in the female. We talked about this earlier, that fecal cells are there to synthesize testosterone in a very less quantity, minute quantity. But what if they start consuming this testosterone? The concentration in the body will increase. And this increased concentration in the female will cause changes, like this will cause increasing the testosterone level in the body. And we know about the testosterone, which is a male sex hormone. Now this hormone, if its concentration is increasing in the body, it is giving us the masculine shape. So if this is increasing in the female, that female will observe, and we will also observe, a masculinity, a male type of changes in the female. The very important one, the first one observed or seen is the facial hair will start growing, and as well in the extremities or in the entire body, she will observe the hairs, because testosterone is actually responsible to cause all these. Along with that, clitoris will start increasing in size. In short, summing up our discussion, the testosterones or the anabolic steroids are the proteins which are actually having the internal testosterones available, which are not actually shown by most of the companies. In short, these poisonous substances that you guys are taking, this will start converting the male into female and female to male. Along with that, it will cause the infertility. And the very well-known statistic is actually the one-third. These signs and symptoms are actually seen in each one-third user of the steroids. Well, so this is a little bit from my side regarding the steroids. Hope you got. If still have confusion or question, drop in the comment box, and thank you for watching.